next fabulous guests, two beautiful people, in fact, Dr. Fahmy Janton and Dr. Lisa Madden. Thank you so much for joining us. Lisa, if you want to, suppose we give us a little bit of a background to Sisu Clinic then.
Yeah, of course. So there are 25 clinics in total, the majority of them being here in Ireland because this is where it started. It has since gone to the UK and also America.
Well, all over the place, all over the States as well.
Absolutely, yeah.
Yeah, every time I look at your site, you're opening another clinic, which is wonderful. It's great news.
It's mad, yeah. It's great. It's lovely, and it kind of just brings it all together. You know, it's quite a community now, which is lovely.
I was sitting beside Fahmy there earlier on, just for about 2 seconds, but of course I interrogated him in that time. And I know you have a background in emergency medicine. So how long are you a doctor for?
I've been a doctor for over 15 years now.
Wow.
I just turned 40 last week.
Yes.
The face don't say it, but yeah, that's...
He's just a perfect
You turned
child.
40 last week.
yeah, come to see Sisu.
Jeez, I have another 5 years to go. Right, we'll talk afterwards.
Oh,
So
100%,
you are in Galway now, I believe. You're based in Galway.
I'm based in Galway, yeah.
In Sisu and Galway.
Yeah.
Now, I know that you're a big fan of what we call these days profilo and polynucleotides, which are skin boosters. Tell us about them.
That's, well, you know, skin boosters are, or biostimulators. You know, it works with your own system to, you know, induce, collagen and elastin to be, to be produced by your own body. So it works over time, to improve the skin quality.
Is this the salmon sperm? Tell us about the salmon sperm you're injecting into
Well,
people.
yeah, that would be your polynucleotides. So it's a, DNA fragments made out of, salmon.
Salmon DNA, really. It's not the actual
salmon DNA
sperm.
from the sperm of salmon, of all things.
Well, she is laughing. Tempted in a laugh in there. My good. Yes, but it does sound quite unusual, though, doesn't it? It does.
It's something that we're hearing about everywhere now. It's kind of the new thing. If you don't want... I mean, I suppose when you think about it, Lisa, when we first talked about aesthetics, I mean, so many years ago now, it was the kind of frozen face look or too much filler, say too much Botox, too much filler. But now it's that kind of natural baby kind of, a little baby element of everything is the big thing. When we look at, say, Hollywood, when we look at all that, everything's changed now.
Now it's kind of going into this thing called the neoclassical area where we're kind of focusing on just regeneration and repairing, and it's lovely. So it doesn't, I suppose, aesthetics for us isn't about just putting a load of filler in the cheeks or the chin or the lips. It's actually about enhancing and improving and maybe reversing what you have already. And I think every day a patient comes into me and they're like, look, I'm not into the filler thing. And then you kind of hone in on the skin boosting element of the consultation, whereas then others might want to enhance or balance something, and then you might speak about the filler. So I suppose, to come back to your point, you don't have to do it all. And also, if you want to try it, it doesn't mean that you're stuck in doing it. So like, we have a lot of mother of the brides coming in and they'll do a lot of treatment, but it doesn't necessarily mean that they'll fall apart if they don't do it again.
James was right that people might be kind of nervous, but I remember talking to Brian actually about this, and Brian was saying, we always feel, is there an age you should start, or age that you can't help anyone anymore? And he was like, no, it's an ageless area when it comes to treatments. Is that right?
Yeah, I'd say nowadays, people are more relaxed on aesthetics in general. It's more like an extension of your own self-care. You eat well, you exercise, and then you have your treatments. And like Lisa has said, that we are going back into the more neoclassical age of beauty. I'd say if you a good example would be Lindsay Lohan. Back in the days where that overfill, yeah, she looks amazing now. That's how the whole field has shifted. It's no more of that overfill, that chipmunk, or the chipmunk cheeks. It's all about enhancing your natural features.
And I suppose it must be great for you guys as well, because some people think always with aesthetic work and that, people are ridiculous, they're doing it for the sake of it. I say 9 out of 10, a lot of people have very good reason for getting aesthetic work done. It must be great to see the confidence then come back into them. It could be something that they've had an issue with or that's bothered them for quite some time.
It's amazing. It's funny. Everyone comes in with some different complaint or something small that I would never have noticed in them, but it really bothers them. And just being able to help them and kind of get them on that journey. And it's not so much that they're doing it for anyone else. It's just they're doing it for themselves, and that's my favourite part of the job.
We're just reading some research the other day, I think it was done at the University of Oklahoma, that spoken to people between the ages of 50 and 80, and they were saying that people who had a positive attitude and looked in the mirror and liked what was looking back at them did better in life and were happier in life. And if you're negative and you don't like the way you look, you are not going to be as happy. So it's I mean, people say, oh, you know, it's not all about how you look, but it's about what you perceive your looks are. And sometimes people go to you guys to enhance what they have, not to try and look like a different person. So I guess how you feel and how you look does affect how you actually, your attitude and how you live your life.
Completely. And also you do find sometimes that patients would come into you and they're at a really low point in their life. And I suppose sometimes they're looking for something just to make them feel better. It's not going to fix their problems, but it just gives them that little boost.
Oh, it's like I just want to chime in there. Like, you know, it's amazing. Like, you know, I've had one who came in. Like, you know, she just finished her chemotherapy regimen, and you know, she just like, you know, obviously, that took a toll on her own body, and she just like, you know, she doesn't feel like herself. So, you know, that's, you know, after the treatment, like, you know, she was like, you know, really happy, and that, you know, is sort of like, you know, helping people to feel like themselves again. You know, that's
a good way to put it. Yeah,
fulfilling part of the job. Yeah.
Okay,
Thanks
I think
for
we're
that,
going to have
Dr.
a few
Fahmy.
questions, James, are we?
We are. Hands up there, folks. Anyone
Yeah,
have a
we have a question
question
here.
for Dr. Fahmy or Dr.
A few
Lisa?
questions and a few prizes.
You're down here to the right.
Do you have any like recommendations about preventative, anti-aging treatments for someone that's like at 25? I don't want to age. I want to go backwards.
No, but it's actually an interesting question because I suppose it leads us to asking what age is the right age to begin?
There's no right age, truthfully. And I think this whole preventative thing is coming on board, and it's a little bit of a touchy subject because then you have like what stops an 18-year-old coming in being like, can I get this done? I would always say to somebody, come in if like the signs are starting, or if you're noticing, that line on your forehead that the makeup is sticking into and it's there when I'm not raising your forehead. You're going to have lines when you raise your forehead, naturally. But it's kind of just looking out for those signs and then come in, and maybe then your preventative process can start. I also love the Profilo and the polynucleotides because it's all just natural. It's just injecting your hyaluronic acid serum. It's just repairing and regenerating collagen and elastin. So I would hone in on them first and then go from there, and we'll guide you whatever way you go,
But it's true as well that we start losing collagen after the age of about 25 anyway, so maybe you're not being dramatic after all. You went, no, it's true though, isn't it? We do start losing that. Interesting.
If anyone wants to get in touch, what's the best way to do so, Lisa?
You can do it online, you can give us a call. It doesn't mean that you have to get anything done, but even if you just want to come in for a chat.
Thanks so much, guys.
Thank you.
Thank you so much.